Redness, swelling, warmth, pain. Most people, including clinicians, think infection, but there's a rare and aggressive condition called inflammatory breast cancer that can look almost exactly the same, and missing it can delay your diagnosis. It's the Pink Ribbon Doctor, your breast bestie. Now let's break down how we start to tell the difference. Number one, we ask how fast did it show up? Because both can come on pretty quickly, but inflammatory breast cancer often progresses rapidly over days to weeks and keeps getting worse. Infection, like mastitis, may also come on quickly, but it usually stabilizes or improves with treatment. Number two, we ask, are you breastfeeding? Mastitis is most common in women who are actively breastfeeding, but it can also occur in women that are not breastfeeding. Inflammatory breast cancer, it can happen at any age and is not related to breastfeeding. Number three, we look to see what does the skin look like. With inflammatory breast cancer, you may see thickened skin, pitting that looks like an orange peel or something that we call port orange. You can have diffuse redness involving a large portion of the breast as well. Infection can also cause redness as well, but usually not that distinct texture change that we see with inflammatory breast cancer. And if mastitis doesn't improve after one course of antibiotics, that's a red flag that you should never ignore. Number four, if you were previously seen by your primary care provider, did it get better with antibiotics? This is one of the biggest clues. Mastitis typically improves within 48 to 72 hours of taking antibiotics, but inflammatory does not. It does not improve, or if it does, it minimally improves. Number five, is there an associated lump? Inflammatory breast cancer often does not present with a distinct lump, which is why it's often missed. Infections may or may not have a lump in the form of an abscess, but the clinical picture usually fits. If your symptoms are not improving, we need to escalate quickly. That means you need to have diagnostic imaging and a skin punch biopsy or tissue core needle biopsy if a mass is present. A classic sign of inflammatory breast cancer is a punch biopsy that shows cancer involvement of the skin. However, inflammatory breast cancer is a clinical diagnosis and does not need to have a positive punch biopsy to make the diagnosis. Now, most breast redness is not cancer, but when it is acting like an infection and not getting any better with antibiotics, we have to think bigger. And if something feels off, trust your instinct and push for answers if your breast infection is not getting better. Please share this information so that another woman who may think that she just has a breast infection has the information she needs that could save her life. And remember, I'm a doctor, but you need to talk to your doctor if you have any breast health issues.